Okay. Hi, everyone. Thank you so much for being here today. My name is Deepa Jayapalan, and I'm the manager of the Healthy and Sustainable Food Systems team at Metcalf. I would like to start by acknowledging the traditional owners on which of the lands on which we're all calling in from today. So I'm on the lands of the Wurundjeri people and Bunurong people of the Kulin Nation. And I'd like to pay my respects to the traditional custodians of these unceded lands, skies, and waterways. Here at and also pay my respect to any Aboriginal and Torres Strait Islander people joining us on the call as well. If you're happy to, please add in the name of the traditional land that you're dialing in from today in the chat, and also feel free to share your name and your organisation as well. So just some event etiquette for this 2-hour session that we have. So please stay on mute unless you're presenting or speaking so we don't get any background noise. Please give yourself an identifiable participant name, so this might include the organisation that you're from as well. We encourage you to ask questions, and please use the chat function for any of these. And you can ask questions at any time during the conversation. So please feel free to do that rather than waiting till the end. And because we've got quite a few presenters today, we'll kind of collate those questions. So please feel free to keep popping them in the chat as you go along. Have your cameras on if you're comfortable. As you can see, the sessions will be recorded, and the slides and the recording will be emailed out and publicly available on the Nourish Network website afterwards. Okay, so today we've got a pretty jam-packed day of session. We've got a few amazing speakers to hear from, and also some time just for us to have some discussions and learn more from each other. So we'll have a quick review of the previous community of practice, and also we'll talk about how Victoria from Nourish Network give us an update on what is happening in Nourish Network world. I'll give you an update on some work that Mikkel was involved in with UNICEF and the EAT Foundation. We'll have Kano, who would speak to us about youth engagement, have a little break so you can get up and stretch, and some community health updates as well. Oh, and also we'll have Dina speak to us about youth engagement as well. The breakout rooms will be facilitated by Vic Health staff and Victoria from Nourish Network, so we get to speak to each other. We'll have a Q&A, and then we'll close the meeting. So you can see that we've got a lot to get through today. So the wonderful guest speakers that we have today are Dr. Dina Leahy, who's the Associate Professor in the Faculty of Education at Monash University, and Krishnadev Singh Kano Ravalji, who's a youth and multicultural advocate, who'll be talking about youth engagement in the space of healthy retail as well. We'll also have guests providing community health updates. So we've got Laura Duff, who's a public health nutritionist at Latrobe Community Health Service, Kaya De Silva, Nutrition Manager at the Arnhem Land Progress Aboriginal Corporation, and Julie Bimbulcombe, who's Associate Professor of Public Health Nutrition at Monash University. I will now pass it on to Veronica to give us a recap of the last community of practice.
Thanks, Deepa. Hi, everyone. I'm Veronica. For those that don't know me, I'm one of the leads in the Healthy and Sustainable Food Systems team here at Vic Health, along with Deepa. Just to give you a bit of a recap on the session that we had in April, it was the first Healthy Supermarkets Community of Practice that Vic Health convened within the Nourish Network. And just to give you a bit of a recap, we shared an overview of the Healthy Supermarkets Community of Practice to date, what's been going on in the space, a little bit about Vic Health and our relevant projects and domains. We also shared the results of the community Healthy Supermarkets Community of Practice needs analysis, which has helped to inform these sessions moving forward. And as always, we are always open to feedback. So any suggestions that you do have for future sessions, feel free to drop us a line. And lastly, we had 4 amazing guest speakers in April. So we heard from Dr. Christina Zorbus, who's a research fellow here at Vic Health, and Deacon Uni, and she spoke to us about the cost of a healthy supermarket shop and policy opportunities to enable people with lower incomes to access healthy diets. So really topical event in today's climate. We also heard from Freddie, who's a health promotion officer at Ballarat Community Health Service, who gave us a wonderful update about his Eat Well, Feel Good Ballarat project that he's been leading with a team there at Ballarat. And we heard from Irene and Benjamin, who are also health promotion officers in the community health space at Eastern Health, giving us some tips on how they've built local stakeholder relationships in working with their local retailers as well. So if anyone missed this last session in April and is keen to have a bit more of a listen and catch up, we do encourage you to jump on the Nourish Network website where the recording and slides are available publicly, as this session will also be. So that's all from me. I'm now going to introduce you to Victoria Hobbs. Victoria coordinates the Nourish Network, which this community of practice sits in, a multi-sector collective working collaboratively to transform food retail practices for the better health of people and planet. And the Nourish Network is an initiative of Deakin University's Institute for Health Transformation. And Victoria will now be providing us with an update from Nourish Network. Welcome, Victoria.
Hi, everyone. Thanks so much, Veronica. Good to see you here today. And we are very proud to be part of the Healthy Supermarkets community of practice with Vic Health. So I thought I would give you a bit of an update. Should I share my slides, Veronica, or are you sharing? I can see them on the screen.
Looks like we're sharing.
Yeah, that's fine.
Would you
good.
prefer to share your own slides, or are you okay?
No, if you can move them forward, or I can share whatever the easiest. Okay, I'll share.
We'll share. Thanks, Victoria.
Sorry, 1 second. Okay, can everyone see those okay?
Yes, we can.
Right.
We can see your next slide as well, but...
do you want to share your slides? Would that be easier?
I can share it for you.
Thanks, Nicola.
Thank you. Brilliant. Thank you so much. So what I thought I would do today is give you all a bit of an overview as to where the community of practice sits within Nourish Network. And as Veronica said, give you an update on the work of Nourish Network, what we've been up to recently. So this is our organisation structure. As you can see, we report through to our director, who is Professor Anna Peters. And myself as the coordinator, I sit across there and report through to the director. And we have an advisory committee, which is made up of all our action team leads. And you can see all the action teams there in the colours, and also some other leads who are part of campus services and marketing, and that really reflects our multidisciplinary, multi-sector approach, which is Nourish Network. We're also lucky enough to have some strategic advisors who are from the retail industry to help inform our work. So as you can see, there's the action teams and their projects, and each one is at different stages at the moment, which is really, really exciting. We and the Healthy Supermarkets Community Practice, led by Deepa, is across to the right, which is, as you know, run by Vic Health. And if you want to know anything more about any of our various projects, please get in touch with me and I can take you through them. Next slide, please. So some of the really exciting things that have been happening with Nourish Network, there's an upcoming international conference called ICO, International Conference on Obesity, which will be held in Melbourne in October. And there's some really exciting research that will be shared at that conference. We submitted an abstract and that was accepted. So there'll be a poster shared about Nourish Network and the multi-sector work that we do and how that's quite unique in terms of our approach. So very excited to be sharing that at ICO, which will also share our work internationally to different researchers. The Healthy Retail Toolkit, which you would have seen, which is run by the Healthy Retail Resources Action Team, led by Margaret Rosman and Bridget Anwar from the Healthy Eating Advisory Service. That's been put together to assist retailers to implement healthy choices in their venues in Victoria. So we're really excited to get that going. And we have lots of great events coming up that we would love you to join in. Some of you may have seen, we have next week, Leah Galvin from Tasmania, who has recently completed her Churchill Fellowship, and she'll be presenting in a webinar and a question and answer with Professor Anna Peters, and I'll show you a bit more on a future slide about that. We also have the amazing Associate Professor Joy Parkinson, who's recently joined CSIRO, previously from Griffith Uni, and she's coming to visit us on the 11th of August. She's a marketing professional who specialises in health and healthy eating. So we're really looking forward to her perspectives, where she crosses over and how we can influence people's behaviour to eat more healthily. And we are very excited to share the launch of the Healthy Retail Toolkit, which will hold a webinar to explain the process of developing that and the research that came from that as well, and how we had focus groups with retailers to ask their opinions on the toolkit. So it was using the actual on-the-ground people who will be using the toolkit and using that to inform the toolkit's next iteration. We also have an end of year event in person in November to get together, reflect, and brainstorm some ideas. So please get in touch if you would like to take part in that. Next slide, please. So this is a little bit about the event I mentioned before, which is next week, with Leah Galvin sharing about values-based food procurement models and challenges. And if you'd like to go to the next slide, it gives the blurb on what the webinar will be about. So I think it'll be of interest to a lot of people here. She has just travelled extensively through the USA and some parts of Europe to understand best practice and look at procurement and local food procurement to understand how we can do things in Australia and where we fit, and look at some of the approaches they're using over there in different settings to help make food healthier and more sustainable. So yeah, please sign up if you would like to attend that event. Next slide. And finally, we have a PhD scholarship open, again, talking about healthy stores. We do understand that food retailers are in business to make a profit, but many of them do want to make a health difference. So Nourish Network's been working with retailers across the spectrum of food supply with the aim of building an accreditation process for cafes, restaurants and other food retailers to help them meet nutritional guidelines. One of the key questions that is asked is how it will help them run a better business. So that intersection between business and health is what we're trying to look at here. So while the idea of an accreditation for healthy food outlets is not new, existing and prior programs have had different levels of success. So we're looking to build on the connections it has with retailers to create an accreditation program that drives both healthier food availability and business profits. So please get in touch if you have any questions about this opportunity, and join Nourish Network if you'd like to keep up with our work. And I'll put the link in the chat if you'd like to get involved. And thank you very much. Thanks, Veronica. Thanks, Deepa.
Thanks, Victoria. That was great. Thanks for sharing all these wonderful opportunities. I know I'm looking forward to hearing more about Leah's journey in the US, and that could be potentially a guest speaker that we get on board for perhaps the end of the year, another session to hear more about her. But if you've got any questions for Victoria, please pop them in the chat. Thanks very much again. I'd now like to hand it over to Deepa, who will be giving a brief presentation on some of the work Vic Health has done with UNICEF and EAT towards building healthier supermarkets for children. Thanks, Deepa.
Thank you, Veronica. So this is going to be a quick update about a small part of a larger project that we were part of. Next slide, thank you. So in October of last year, EAT Foundation, which is a global foundation that works to address sustainable food systems, UNICEF and Metcalf convened a youth consultation. This was part of a broader piece of work that was happening globally that I know Gary Sachs was very heavily involved in getting the voices of young people and using it to influence for better, healthier retail and influencing at the shareholder level. So I'll just present on our part, as I wasn't involved in the bigger project, so I don't want to speak of it and may get some facts incorrectly. So I'll speak about our consultation and the experience that we had running it. So the purpose of it was to invite young people to share their experiences on food retail, to get their say about what they want to see differently in these spaces. And we held a 2-hour session where we talked about price, place, promotion, and product. And we used a tool that the EAT Foundation had created. Next slide, please. So the tool that we use is called the Co-Create tool. And I think you can see some more information about this tool on the EAT Foundation's website. It was the first time for me using that tool, and I was one of the breakout room facilitators as well. And it basically, you're using Zoom, and you can use the annotate function on Zoom where people can kind of write on their screen, which I had never done before, but it made it really easy that people were already on a Zoom call and they could just basically write things on a screen. There was a template, as you can see there, like it asked certain questions, people drew themselves and they just wrote things in there. So it was a very accessible way for young people to do this. They weren't having to download another software or anything like that to participate. So we had 3 breakout rooms. We had moderators from UNICEF, EAT and Metcalf. So they were coming in from a global setting. They were on very different time zones, but all the young people that we interviewed were all in Victoria itself. And I'd like to talk about some of the themes, the common themes that we found from that session. Next slide, please. Thank you. So we asked young people what type of food and beverages do they want to see more of in their retail stores. They talked about health and healthier food options. They actually wanted more fruit, healthy snacks, natural juices, and less highly processed food. And they also wanted portion controlled snacks as well, which is quite interesting. They wanted different food from different cultures and halal options. Many participants felt they need to go to specialty stores to find ethnically diverse food products. They wanted a greater variety of foods for allergies and tolerances, including more vegetarian and vegan options and beverages with low sugar. They wanted in-season fruit and vegetables and local products, and sustainable packaging and less plastic as well, and easy lunch and dinner options. Most of them talked about the issue around price. And I guess in October of last year, the dialogue around price hadn't really kicked off yet, even though price has always been a massive issue, a barrier for so many people. They all still spoke about the need for cheaper, healthy options. They wanted, in terms of promotion, they wanted greater transparency on ingredients and pricing. So the reason of how prices come to be, which I thought was quite interesting, and also clearer labeling to distinguish between healthy and unhealthy food, and more education on reading food labels and for us to improve the health star rating process. Next slide, please. So we asked them, do you find it easy to identify healthy options based on the information provided in stores, and what would help you more? Most participants felt that it was difficult to identify healthy options based on the information provided and with misleading labeling and marketing. So many of them identified the health washing and the greenwashing that happens across food. So it was really interesting that they could pick on these things, but they found it frustrating that they had to deal with it at all. Participants highlighted the responsibility of producers and retailers to educate consumers on healthy food options instead of misleading them. Young people felt that companies often use buzzwords in a misleading way to promote food, so gluten-free, keto, vegan, and that there should be universal labeling in place, including for imported products, and the need to strengthen the health star rating. On equity, participants mentioned that only consumers with a lot of time and money have both the resources and education to select products, which we all talk about a lot, and we talked about it in our previous Healthy Supermarkets Community Practice. And they played a role. They also said that the supermarket and the physical space played a role in educating people. So it was hard to navigate the physical space to be able to find the healthier foods as well. Next slide, please. So we asked, what type of food and beverages do you see advertisements for while you're in the food retail store? So this could be in-store or online marketing via stores or via websites or apps. Young people largely identified that they saw nutrient poor and energy dense foods as mostly marketed to them. This included snacks, energy drinks, alcohol, meat and dairy, chocolate, big brand foods. A lot of them were quite frustrated by the way that alcohol was marketed to them, and they found it really irritating, especially during this time. We were just coming out of that second year of lockdown, and they felt like they're being targeted in a really manipulative way, trying to target their emotions as well. And they wanted more regulation on alcohol marketing specifically. Next slide, please. So we asked whether they preferred shopping for food in a physical environment or online applications. Overall, the preference was contingent on various factors, like it was kind of almost an even split. Those who chose online chose it at that time for COVID reasons, and that they found it easier to control their budget when they were buying things online rather than being out in a supermarket and not having that control as much. And just the convenience. For those people who are using in person, they identified the higher delivery costs, I guess, depending on where they live, as well as why they would go to a store instead of buying online. The desire to hand select products, desire to see the details of the product, and they were interested in specialty products as an incentive for buying in stores. So I guess certain stores where you can't actually buy things online, like local cultural grocers. Next one, please. So if there's one thing you could change about your food retail environment, what would it be? So once again, it was health. They wanted more healthy products and healthy alternatives. And they also said they wanted designated healthy days at supermarkets where it could be like some sort of, I guess, a showcase of the healthier products that makes it really easy for them to identify. They wanted to introduce more plastic-free options, increase consumer ability to buy in bulk, wanted more opportunities to donate food that would otherwise be wasted, and wanted supermarkets to be transparent about their food waste practices. They wanted supermarkets to start stocking more local, retailers start stocking more local produce and multicultural food that's particularly healthy as well, not just the packaged unhealthy options, and increase affordability of healthy food products. And something that I'm sure many of you would like to hear is that they did not want unhealthy foods near the checkout counters or at the end of aisles. That was incredibly tempting and kind of encouraged their impulse purchases, both from a health perspective, but also from a budget perspective. They wanted to make healthy food accessible and available, especially in more rural regions, make supermarkets disability friendly. So a few of them spoke about the fact that having various disabilities, that they liked the options that some supermarkets had to having those times where there's less music and there's lower lighting. Some of them who didn't also identify as having those abilities said that they just enjoyed shopping more so when that environment's created rather than the loud noises and bright lights. And increasing the number of stores in suburbs to promote walkability. They wanted to introduce a clearer labeling system, improve in-store education on healthy food and beverages, and introduce interactive cooking lessons and displays, increase transparency and less promotion of alcohol. Next slide, please. So we're not going to have time to kind of discuss this right now, but just something for you to consider. Please share your thoughts in the chat. Do these results surprise you? Do you think the retailers that you work with would be surprised by these results? Do you think these results would be similar to what you would find in your communities? And do you think this type of information would support you in advocating for the change you want to see? So I'll leave it there because we have some really great presentations, but please think about this and we can talk about it further in the breakout rooms as well. Thank you.
Thanks so much, Deepa. Fascinating results there, and I think they're really beneficial getting the perspectives of young people. There was a question whether these references would be available for people to use in their own work to be able to reference. Is there something that can be available for them? I know there is a PDF. Is that something we can link in the chat?
Yes, yeah, I think Julian's just done that. So I think that is fine. Yeah, please feel free to use it as best as you can. We want everyone to be able to use these kind of results. Also think about how you could conduct similar interviews and consultations if you have the capacity and ability to do that in your own community.
Excellent. Thanks so much. And if you've got any other questions for deeper around this work, just pop them in the chat. We can come back at the Q&A session later on. We might just stop sharing our slides and I'll let Dina share her own slides. And I'll just introduce her while she's doing that. I'm really pleased to introduce Dina Leahy, who is an associate professor in the Faculty of Education at Monash University. Her research draws on interdisciplinary perspectives to critically study health education, from policy formations to their translations into everyday pedagogies. While her work has a strong school focus, she has recently begun to explore the possibilities of other pedagogical spaces and approaches that seek to teach us something about health, including museums, exhibits, festivals, kitchen gardens, and various digital technological platforms. Dina will present an overview of the Kids Co-Designing Healthy Places projects involving children and young people in the process and sharing their perspectives in helping to shape healthy and sustainable food environments, such as supermarkets. Welcome, Dina. I'll let you take over.
Thanks so much, Veronica. I really must reduce that bio to something a little simpler. Thanks ever so much for inviting me along to present today. And I'm really excited to present a project that is actually still in motion. So it's always tricky to do that. And I can see that there are some people in the audience who actually would have some familiarity with this project from working in local government areas. And so it might be that they've got some insights to share as well. So today I thought I would share the Kids Co-Designing Healthy Places project with you. I'll present the model and some of the examples of how councils have implemented the project, keeping in mind it's still in motion in several local government areas. Consider how the model could be adapted to focus on supermarkets, and you'll see throughout the presentation that there are lots of connections or touch points to thinking about retail environments and particularly auditing retail environments. And I also want to share an upcoming project we're currently in process of developing, which is building a future healthy world in Minecraft. And we're thinking there about what it might be to build, for example, a future healthy supermarket with kids being the builders. So just a little bit about the project. And as I said, some of you are quite familiar with the Vic Health Local Government Partnership, but Kids Co-Designing Healthy Places is one of the foundation modules that local government undertook as part of the partnership. And so we worked alongside Connecting the Dots, which was a Deakin University project. And the purpose of this partnership and also of Kids Co-Designing Healthy Places, is to engage kids in particular in auditing their local environments and contributing to finding solutions that local government ideally would pay attention to and would inform their municipal public health and wellbeing plans and or action plans. So there's 23 local governments involved in the process, and I worked closely with 13 fast track councils. What we did, and do keep in mind that we signed the contract just as we went into lockdown. So our idea of co-designing this with councils and with kids went out the window, as did many things during that time. But we developed a website toolkit that could be used by councils to engage kids in this co-design process. So councils were our primary audience, but our secondary audience was schools, because we thought, and it's no surprise there, I'm in a Faculty of Education, of course schools are going to be in the mix, but we thought schools would be a really important setting for councils to work with, given their interest in seeking out kids' ideas for change in the local environments. And so the website contains a whole suite of resources for councils as well as schools, and we've gone from early childhood settings right through to the 7 and 8 context in secondary, but there's also extension into 9 and 10. So we were trying to make this project something that schools might take up and also use the opportunity to engage kids with local councils or councils engage with schools. We thought that was a really generative potential partnership. It's not to say that all councils engage schools, really tricky during COVID. tricky anyway, but tricky, extra tricky during COVID. But some councils managed to do it really well. Other councils decided to engage kids through community festivals, libraries, etc. So there's a whole range of ways councils did this work. Basically, the project is divided into 3 phases. And the first phase is really about ensuring that kids have the requisite health literacies that will enable them to actually audit their everyday places and then be able to contribute effectively to co-designing solutions. I think more often than not, when we look at participatory projects or even just engagement projects, we tend to just go straight to the kids and ask them from their experience what their ideas are. Whereas we thought that we would actually supplement those kinds of models with a phase that deliberately sought to engage kids in learning about the social determinants of health. Now, if you want a physical challenge, this is one of them. Teaching people about the social determinants of health is tricky at the best of times. Talking about them with adults is tricky. Thinking about taking this down to a primary level was fun, but we thought what we would do to do this was to produce an animation. So I'm just going to show you a part of this animation. I'll click on it and the screen will go to YouTube. So just be ready for that. And it's 3-minute-ish animation, but I'll cut it off after the healthy food. So hopefully you can see that and hear it. I'll stop it there, simply because we look at being active. But not my video, is it? Doing that noise?
It's Deirdre.
Oh, okay. All right. Well, that's okay. So that animation, as well, we kind of prepared a range of resources to help councils and schools unpack that animation and to highlight, to work through what a physical environment is, what a social environment is. And so when kids went to do their audit, they were hopefully better informed and they were able to look more broadly and differently at their local neighbourhoods. And so the auditing options we provided to councils were a quick audit. So councils who didn't have much time, there was a digital story audit option and also a survey. And so councils either did one of those or they combined the survey with either the quick audit or the digital audit, or one particular council that I'm just working through the data at the moment offered options. And so the kids could actually choose what they wanted to do. So just to share some examples of the ways in which councils engage. This is actually happening now. So this is July 2022 and it's Shepparton. They created a whole magazine insert that went into the local newspaper, and there's about 12 pages of activities and the survey and links to online connections to engage young people. But other councils set up their own websites, where they embedded the animation. Some councils, they adapted the website, which they were quite welcome to do to cater for different literacy levels and certainly for diverse language groups. So that's just an example of how kids co-designing healthy places has been picked up in one local government area. Here's one council collated their data into a collage, and you can see here, these are examples of the quick audits where we simply ask kids to go on a travel around their local neighbourhood and take photos of their local environment, and it was for good and bad. So where they actually picked out things that were problematic or things that were positive. And this data, this audit data, is really quite crucial in moving into the third phase of the project. Just to show some other examples, this is from Bendigo, where a teacher really got on board with the project, and kids produced posters where they went out and did an audit of their town, and they looked at both healthy eating and being active, as well as active transport, which was kind of like a subset of being active. And you'll see those pop up a little bit later on in the presentation. I do want to share this with you because this is a digital audit that was prepared by a Year 8 student. If you just bear with me, I'm going to
North Fitzroy
take you through to the audit with the focus on the shops. So keep in mind, this wasn't supermarket specific. It was asking young people, in this case, to audit their local environment for healthy eating, being active, etc.
At the shops. Peter Monty's is our local supermarket. It is like all major supermarkets, providing a range of healthy/non-healthy food. Another option for healthy food is Wild Things Organic Market, but it is quite expensive. Other options for takeaway food include kebabs, hot chicken, falafel, North Fitzroy.
That's the end of that. But I just wanted to show what the digital audit can look like for you with the focus on the shops. Clearly, there's another layer that we could have gone down into to actually go into the supermarket and do a more thorough audit, but that wasn't the focus of this. So finally, the final phase of Kids co-designing solutions for creating healthy places involved a workshop. So that's where we got the data. We'd done some, the councils did some analysis of the data, but took the data through to the workshop phase where kids unpacked the data, made sense of it, identified the major issues that came through in the data, and then set priorities, and then worked together, ideally with council folks sitting at the table, to think about, well, what are some of the possible solutions to the problems that they've identified in the local community. So just to show you an example of how the data was sort of analysed and pulled apart, we had these huge posters, and we pre-prepared a set of cards based on the data that we collected. And kids were asked to look at their card and see whether or not that impacts on being active, on healthy eating, or feeling safe. So that was the first stage of analysis. We then moved through to trying to identify, well, which things actually have impact across a range of different health areas. And so we started to connect the dots, which if you go back to the start of the presentation, you would have seen that we talked about connecting the dots as a foundation module. So we set this project up for students to start to develop links across different areas, and that helped them prioritise what the major issues were. This is you can see the posters and the audits in the background. We're in a marquee in Bendigo, and this is the Mayor, Councillor Andrea Metcalf. She came in for the day. The kids had a red carpet to walk into the tent on, and Andrea was there telling the kids that she was really looking forward to hearing about their ideas for a healthy future in Bendigo. And she spent some time talking about how the council were going to work with the kids' ideas. And the kids were pretty chuffed about meeting the mayor, but I think they were more chuffed about having the red carpet, to be honest. Just to show you, just to close the loop a little bit and think about how kids connected with councils after the workshop. I just want to share this letter with you from the kids. Just have a read through there. So one of the benefits, I think, of this project, and we're clearly still doing the research around it and some of the evaluation is the benefit to councils and the benefit to kids. And we think about particularly critical food literacies and critical health literacies and social action. We think about civics and citizenship and helping kids understand the role of local council, all really valuable outcomes. One of the things that councils are talking about is how do they actually feed back to students about the changes that they've been made. And so the councils that I've been working with are thinking about how to actually provide feedback to the students or to engage them also in their action plans. So finally, I'm just mindful of time. What's coming up next? Well, we're currently interviewing key councils. We're also waiting for other councils to finish. They've been held up for all sorts of reasons. We're collating the kids' data from across councils to identify what the key trends are. We want to analyse the municipal public health and wellbeing plans and action plans to see where and how kids' voices have been embedded in those. And we're also working on a new Minecraft project, which kind of rips off the Kids Co-Designing Healthy Places project. And I know I don't have time to share that with you, but I just want to show that we're actually working with Minecraft and Vic Health and Future Healthy around a project called Kids Building Healthier Futures. I won't show an example of a Minecraft build, and some of you may know about it, some of you mightn't. It's the most popular online digital game for kids in the world, and we're trying to utilise that in this particular project, and we've just mapped out our future healthy world, and kids will do a similar process. They'll audit their local environment and then they'll come in and they'll build their solution. So rather than just saying their solution, they're actually going to build their solution in Minecraft, and they're entering the online game in a construction zone. So the future healthy world is currently under construction, and you can see here we've got all of the main settings that kids might choose to do their build about. So they might want to create a future healthy supermarket, and as they make their way through the game, they'll be developing the key literacies required in order to make decisions about building a future healthy world, and they'll get to pick their setting. And I'd love to come back when this project is finished, if anyone does anything around supermarkets, and share those builds with you. Thanks very much for your time and for listening.
Thanks so much, Dina. Such fascinating research. I always love hearing from you and the latest updates, and really exciting possibilities moving forward as well, especially looking into different food environment spaces that children interact with. So I would encourage anyone that has any questions for Dina to pop them in the chat as well. She'll be sticking around. And perhaps if you wanted to include any of those YouTube links in the chat, Dina, and people can have a look at some of those Minecraft videos in their own time, that would be great as well.
I will. I'll share a couple of builds. I'll share one of a community garden that was built in Minecraft, and I'll try and find one that where a kid looked at a local cinema and tried to change the snack options as they built a future healthy, sustainable food world. Thank you.
Excellent. Thank you so much. So it's my pleasure now to introduce Krishna Dev Sin, who also goes by Karnal Ravalji. Karnal migrated from India to Australia at the age of 7. He's now an advocate of youth and diversity, and he's keen to inspire young people to become comfortable with themselves by sharing his own journey and learnings. And he's here today to provide an insight on the perspectives of young people in terms of healthy supermarkets. Welcome, Karnal, and Karnal will be answering any questions right after his presentation. So please pop these in the chat as you're listening, as there will be some time straight after. I'll hand it over to you. Thanks so much.
Perfect. Thank you, Veronica. Hi, everyone. Look, we got about 10 minutes today, so this is going to be a crash course. I would love for you to put your thinking hats on, and if there's any questions, would love to answer after as well. By the way, feel free to enjoy my view. I'm currently in my office building that I'll jump in and do a quick presentation. So before we begin today, I'd like to acknowledge traditional custodians and land on which we are zooming in today, and pay our respects to elders past, present, and emerging. And I extend that to all Aboriginal and Torres Strait Islander people here today. And as a migrant myself, I am extremely lucky to be able to call this country home. And I understand these lands were unceded, and sovereignty was never ceded. So what is my name? You might have seen it and you're like, whoa, that is a very long name. But I'm on a mission to make sure everyone that I come across knows how to pronounce my name. So my name is Krishnadevsi Champaksi Rabalji, 4 syllables. Krishnadevsi. Love for you if you can call me that. We don't have time to go into that, but you can always call me Kano for short, or just Ka and No, as easy as that. So what do? I do some youth and diversity. I'm a youth and diversity advocate. I go into schools. I'm a young person myself, but I work with a lot of young people around diversity, inclusion, racism, and all of those things. I've been blessed to, I think the best thing about working in this field has been meeting so many amazing young people from all different walks of life. And I'm glad that I could get all these different experiences into my armory as well. So I think the first thing that we should think of, why should we engage young people? I think sometimes engaging young people becomes like a tick box, or, oh, you know, we need to do this co-design, or we need to consult young people. I want to really reframe, and why do we actually want to engage young people? And it's very simple for me. I might go through this a bit quickly. Don't worry, I'll provide the slides as well. But I think the biggest thing is that what we can learn from young people is that their lived and living experience. What I talk by lived is, I'm a migrant myself, coming from India when I was about 7 years old. Typical story, living in a 2-bedroom house with 13 people. And, you know, going to a supermarket wasn't always about buying the healthiest food. It was all more about what's cheapest, what can feed the family, what will stay the longest for a long time. And this is just my experience, but there's so many other young people with so many different lived experience which can tap into. Then also is living experience. Young people, they're currently living, they're young people, but also other experiences from all different walks of life. And the cool thing about young people, I believe, is that especially during this stage, they go through so many different experiences where they're figuring themselves out. They start learning about how they grow up, all these things. So it's very important that we tap into that, because I think you realize when you work with young people, they know more about themselves, or they realize more about their experiences. The next point is that young people will become the long-term consumers, especially that 18 to 50 range. We know that's where a lot of the big cash comes in, big spending. So it's important that these young people, especially who are about 16 or 18 plus, will become the future parents. They'll be the caretakers of elders, and they'll become the biggest spenders. And we want to make sure that if these these young people are going to become future parents, have future families, that they have access to a healthy supermarket, or their voices are heard in that perspective. And also, perspectives on young people want now. The way I like to pitch this is, for example, social media. When I guess other older people make decisions on social media, they didn't grow up with social media the same way young people did. Young people, we grew up at social media being the norm. Same way. So I feel like it's a bit hard for the older generation to know what young people want in social media. Same thing I feel like applies to healthy supermarkets, where young people would really older generation might not have a clear idea of what young people want. So it's important we tap into them. And also, young people are very cautious, very conscious of what brands are doing, especially in terms of their environmental sustainability, their diversity, inclusion, and that can have a big impact on if young people can cancel culture is big in young people, or do we not buy from this brand, or do we buy from this? So I think by engaging young people, we get to learn those trends that are coming and upcoming. And what do young people think about supermarkets, right? A very quick crash course. Growing up myself, I didn't see healthy supermarkets being advertised to me. It was very much, it's just another supermarket. There wasn't a big emphasis on healthy. The connotation I had was that healthy is usually expensive, doesn't taste very good. It's not for me, a migrant myself. It's not something that my family can look into. And also, growing up in supermarkets, we didn't see a lot of cultural foods represented in markets. And also when it comes to things like the food pyramid in schools, we didn't see a lot of cultural foods. And I think this is a very key point, especially with Australia becoming more and more diverse. I think the recent census data came out that 3 in 10 Australians are born overseas. And I think that's a pretty big figure just in the whole of Australia. So it's important that we acknowledge and are working towards that. Second point is that young people are concerned about world issues. I think young people are leading the change at the forefront of climate change, all these other things, and it's important. And young people want to be involved. And sometimes when they see institutions that don't make change or don't take that step forward, they can be disinterested or not wanting to participate if they see, for example, institutions not wanting to take action. So I think young people are very much concerned about these issues. And also another thing is cost of living. Let's be honest, it's very expensive at the moment. If you're a young person living by yourself, or anything. It can be very, very expensive with uni, with public transport, all these other costs. And young people are looking to cook at home, which might mean that they're going to more supermarkets, trying to find good bargains, trying to eat a bit more healthier as well. And here's my quick pitch. How do we engage young people? In my perspective, the first step is we need to invite them. Like I am invited today, supermarkets, all these conversations, it's not traditionally, it's a topic where young people are not included. They're not traditionally involved in the process. So it's important that we give them that representation. We give them the platform to share their opinions, to find their opinions and to share their opinions. And the other thing I want to say is a change of thinking around, I think organizations or businesses have this idea that young people don't want to be involved, or they're too lazy, or they're not going to care about supermarkets. Like supermarkets, no. But I think we need to change this thinking that young people want to be involved and what they say matters. But it's about finding those young people and giving them the reason to care. And that's where I feel like the ethical engagement comes in, where one, you're paying young people for their time, you're doing proper engagement where it's not just a one-off consultation, you're following up with them further, or you're giving them more. If you do a report, sending it back to them, oh, what do you think of this? Is there anything I missed? Making sure it's ethically done, and that young people are not just another tick box, which I'm afraid that a lot of these, I guess, especially engaging young people in my work in diversity and inclusion, that's what it sometimes is becoming. But I want to make sure that we're really focusing on doing ethical engagement. And I'm sure, I think we touched on this, is more co-designing, giving young people the ownership and a reason to get involved, owning that, this supermarket of the future is my supermarket, or I can have influence over that. And the last thing is giving more platforms to young people to get educated. The cool thing about young people is, one, they're young, their opinions are still being formed. So it's giving them that education, giving them that platform to find out for themselves. And once they have that, giving them a platform to share and be heard. So that is it for me. Look, very quick crash course. I'll send the PowerPoint slides as well. But I think it's very important that we engage young people and we give them a platform to get their voice, to find out and share, because young people, as I said, will become the future spenders. And it's important we get them involved in our conversation about what the future healthy supermarkets look like. So that is it for me. Thank you.
Thank you so much, Karnal. We always love hearing from you and your perspectives. And I think everyone's found it incredibly valuable to not only hear of your own experiences, but from a young person as well. And amazing crash course. You've nailed the time, but we do have time now for some questions as well. So if you do have some specific questions that you would like to get Karnal's perspective on, we do have some time for that as well now. So feel free to come off mute, pop it in the chat, or pop your hand up, whatever's easiest. You might have to just come off mute because I can't see everyone's faces. Or any comments as well.
Thank you so much for your presentation, Kano. I'll ask you a question if no one else has any. So I'm just curious to understand from your perspective, what are the areas you would like to work? Like when you see, there's so much, processed food, which is so readily available. Where do you think we can work to, promote healthier food in our retail environments? Like, is there a particular starting point, from your perspective?
I think that's a great question. I think in terms of processed foods and making them available at a cheaper rate, and I think sometimes that food is available. Sometimes it's about spreading that information to let young people know, hey, it's easy to grab these food from the grab and go. It's so much easier to do that. But if you maybe plan a bit in advance, or showing them the benefits of that you can, even though the times that we live in, you can still live cheaper on a healthier budget. I think young people right now we live crazy lives. We have so many, I feel like we have so many commitments. We're always go, go, go. And so we try to eat, we try not to eat fast food, but sometimes that's what happens, or sometimes we eat bad food. So I think promoting the message around that healthy food can be good for you, and also it can be reasonably priced as well. And maybe educating around that, I think, would be very important. That I feel like we don't see a lot of messaging around. So I think more messaging around that would be good, would be quite helpful.
Yeah. Sorry,
Thanks,
Kano. Forgive me if you've already explained this. I've had to duck in and out of this this Zoom, so I might have missed a few things. But so, are you saying that, like a lot of healthier food, like when you talk about cheaper rate, are you saying that like a lot of healthier foods are more expensive, or are you saying that they're just the information about how to cook and prepare healthy foods for a good price is not available?
Great question. I think it's a twofold. And the first thing is the perception that healthy food is more expensive, or healthier food, especially when you go grab and go, or when you go to a supermarket, it's going to be more expensive. I think changing the conversation that healthy foods can be cheaper, and one way that can be cheaper is by having all these recipes, or having these tips and tricks of how you can make healthy foods at a cheaper or a easier rate.
All right. Okay, great.
Thank you for the question.
Veronica, it's Lisa. I've got a question.
Go for it, Lisa. Thanks.
Hi, Kanu. That was awesome. I love your photos. So I'm in conversations with young people, and one of the biggest, amazing, awesome things that came out of it is a lot of cultural recipes are handed down. And when a lot of the families relocate to Australia, some of the traditional ingredients either aren't grown in Australia or sourced in Australia. And we're trying to explore a way of how we can substitute some of those ingredients so that Mum can keep cooking that she brought over with her because it's her favourite meal. Or people, when they start going to uni, they want to cook what Mum cooks, but because they don't know where Mum gets the ingredients from, they don't know what to substitute. So I'm trying to explore that narrative at the moment, and I don't know if you've come across that type of conversation or that space.
No, great question, Lisa. And I know growing up as a migrant myself, that happens a lot where, for example, my mum's cooking or my parents' cooking come from living 35 years in a different country where this is what they grow up with eating. That's normal for them. And then you move to a new country. First of all, you don't know the language, you don't know where the supermarket is, you don't know how to navigate, and then you want to eat your own food. And I come from a vegetarian background, and so that becomes even harder. Because a lot of the vegetables that we eat, they're not here. And so one of the ways that we do is we go, the ethnic supermarkets or the Indian groceries where we get frozen vegetables. But I think from my perspective, I saw my mum's cooking, but I never saw it outside of the household. I never saw it at school, never saw it any other places. So I think for young people, changing that around, again, I was saying I never saw a food pyramid that had, for example, roti or naan or curry on there. I never saw that growing up. So maybe if you can change, or maybe tell people, oh, sometimes Indian food can be healthy, or it is recognized in this modern world, or here's an alternative way of cooking it and living in Australia. So I think changing that, telling young people that you can eat your foods, or that it is healthy, and then you don't have to keep it at home, and it's something that you can pass down. And you can find, you might not be able to find all your vegetables, but maybe if you're to an ethnic a grocery, you might be able to for the frozen types, or these other ways around it. And I think the more conversations that we had around, we eat this at home, but we can't make this. But if a few more people talk about it, you get involved in the community. I can guarantee you, some cook has figured out a way to cook it here.
Yeah.
Thank you. That was awesome. I might link in with you.
Excuse me.
Thank you, Lisa.
Just wondering, actually, to the person who just asked the question, this is just a curiosity. Where are you located, and could you give us an example of one of the ingredients, or some of those sort of ingredients that weren't available where you are?
Yeah, sure. I live in Frankston, but I work in Cardinia, which is Pakenham. So it's all the outside southeast of Melbourne. So we're blessed with lots of farmland and lots of fruit and veggies, but we've also got an amazing diversity of neighbours from Sri Lanka, from South and North India, from all the different Asia Pacific groups. We've got a lot of, people from the islands. And we do a lot of food celebrations for not only special days, but also exploring home budgets. And so the constant conversation that comes up with what I would call non-Anglo diets and non-Anglo-centric diets is this, or I don't know when it is seasonal to cook that, because at home I'd cook it in May, but I'm finding in Australia I'll probably cook it in October. So that's sort of the example I bring to the table.
Okay, thank you for that.
Thanks, everyone. I'm so sorry. I hate breaking up conversations like this because they're so valuable. And thank you for all your questions, everyone. I do encourage you to connect with Kano if you would like offline to continue the conversations, or just reach out to us if you're interested as well. But thank you very much, Kano. We really appreciate your time again, and out of your busy schedule, and best of luck for everything. But we will be in touch. And thank you again.
Perfect. Thank you, everyone. Have a good rest of your day.
Thank you. So because we've run a little bit over time, I'm going to hand it over to Deepa now. Thanks, Deepa.
Thank you. Thanks, everyone. So we're up to the community health updates now. So once again, please just keep asking questions in the chat when we go through these community health updates, also for Dina as well. So first, I'm going to introduce Laura Duff from Latrobe Community Health Service. Laura is an accredited practicing dietitian working as a public health nutritionist at Latrobe Community Health Service. Laura has over 8 years experience in the health sector. She's a systems thinker that is passionate about nutrition, health and wellbeing, and we'll now hear an update on Reach for the Stars Healthy Supermarkets project in Latrobe local government area. Welcome, Laura.
Hi everyone, thanks so much for having me here today. I'll just get my screen up and running. How is that? We can see hopefully just the presentation.
Yeah, perfect.
Yeah, fabulous. All right. Thanks so much for having me here today. As I said, my name is Laura Duff, Public Health Nutritionist at Latrobe Community Health Service. And I've been invited here today to give an update on our Reach for the Stars project, Healthy Supermarkets Latrobe. Before I go any further, I'd just like to acknowledge the traditional custodians of the land which I'm on, so that's Gunai Kurnai for me. And also all the staff and community members who have worked on this project too. So I'm here presenting on their behalf, but there's a lot of work behind the scenes which has gone into this project. And before I get started any further as well, just to say that Reach for the Stars is an initiative of the Latrobe Health Innovation Zone. And we have funding from Latrobe Health Assembly in partnership with the Vic government for this one. So, a little bit of background for us. I have presented a presentation on one of these before, but for those that may not have seen it, we're located in the Latrobe Valley, which is about 2 hours east of Melbourne, rural regional location. We have a big health promotion team, and that's because you can see, unfortunately, we do have some poor health statistics for our area. I won't go through those, but healthy eating is a real key focus of our work. So we got really excited when we saw the Eat Well at IGA Bendigo project. We just thought, using the supermarket setting was incredibly clever. It's where we're making our decisions about what food we're buying, so therefore what we eat, and also that it's got a huge potential for reach and scale across the community as well. But I do know that I'm preaching to the converted with everyone here today. So we came up with the idea of this project, Reach for the Stars. So based on Eat Well at IGA Bendigo, we wanted to co-design and implement healthy retail strategies with supermarkets, and particularly focusing around that promotion of healthy foods. So that the hope is that Reach for the Stars is going to make it easier for customers to find healthy foods in the supermarket. We've got a range of different interventions that we've come up with, and most of them they're all based on the Australian Dietary Guidelines and the Health Star Rating System. So all of these interventions based on evidence, we've done testing with La Trobe shoppers as well and tested positively with them. And from the retailer's point of view, it's feasible to implement as well. So we've got a couple of key different interventions, and that includes that all fresh fruit and vegetables are 5 stars, having some shelf tags on products which are 4.5 and 5 stars, having some healthy eating messages from our La Trobe stars, and some healthy recipes as well. And in addition to that, we'll just have some complementary things like a social media campaign and a comms plan, just promoting the project overall. So our implementation has been a phased approach. So we've started off much earlier down the track with a scoping phase. So that was to see whether this project was actually feasible to implement in our region and with supermarkets. After that, we moved on to planning. So that involved all of our engagement and recruitment with supermarket stores here locally, planning our intervention in a bit more detail, designing our evaluation and collecting our baseline data too, with some customer surveys and completing store scouts. And I'm really, really pleased to say that we have finished the planning phase and we're just about to move into the implementation, so an 8-week pilot in supermarkets. So that means you're all up to date now. So I'll give you a little bit of a update of what we've been up to and where to from here. So what we've been up to is that we've been able to officially get partnerships with 3 participating supermarkets. So that's Glengarry, Morwell and Moe IGAs. And I'm really pleased to say that because we've actually exceeded our target of hoping to get 2 supermarkets on board. Yeah, we've been able to design our evaluation and collect some of that info. So some interesting findings from our baseline data collection was that 1 in 4 customers found it difficult to know whether a product was healthy or not. And only 1 in 2 customers could correctly identify whether a product had a high health star rating. So I think both of those combined shows that there is a need for a project like this, and it's filling in a knowledge gap. The other interesting finding is that we did store scouts assessments of all of our participating supermarkets. So that looks at the healthiness of the supermarket environment, giving it a score of 100 being the healthiest and 0 being the least healthy. And our participating supermarkets scored considerably lower compared to benchmarking major supermarkets in our region too. So again, it means that we're targeting the stores which need it the most. As well as that, we've been able to create all of our marketing materials, and actually just excitedly sent that to the printers recently. And we've been working on a comms plan with a website, customer flyer, information sheet for staff, press release, the whole shebang to try and promote the project too. And then the other thing is that we've been able to recruit 5 La Trobe stars. So La Trobe stars are La Trobe locals, and they're just sharing how they shop, cook and eat healthy foods for themselves and for their family. So this is going to be some of the marketing materials which we'll have in store. The idea behind this is that it's promoting healthy eating through those social norms. And for me, I really love this because it's giving us a really, really local flavour with, you know, faces that we all know. So a little bit of a sneak peek here. My favourite is this one from Jackie from Morwell, who freezes healthy meals to eat later on, her fake away meals. Where to from here? So as I mentioned, we're really, really close to our implementation stage. So that's running for 8 weeks in our participating stores through August through October. So in fact, we're actually only 1 week away from launching from our very first store at Moe IGA. and 3 weeks away from launching at our other 2 stores, Glengarry and Morwell. So my hope is that we'll actually be able to present some early findings at the next community of practice meeting that we have together too. So we'll be putting up all those marketing materials in store soon, holding some launch or activation events, promoting the project and collecting all of that evaluation data too. After that's completed, we'll be completing an evaluation to see whether the project's been successful. And if it is, we'll look to scale up to more supermarkets locally and maybe some more interventions too. So it's really exciting. I think, you know, this has sometimes felt like a little bit of a marathon for us. We've been working on this project for a number of years, but it's really exciting that we're coming close to actually implementing in stores. And that's because I think there's so much potential for impact and that we're getting to the customers that really, really need it the most. And that this project is being, you know, designed by our community for our community as well. So that's everything from me. I've just got contact details there if anyone wanted to get in touch. Thank you.
Thank you so much, Laura. That was amazing. And I can see some applause and clap reactions you're getting because, I mean, it's amazing that you went above your target. Firstly, that's so impressive. And I just love the way that you embedded kind of people's stories and their tips, and you just made it feel like that, just that community-led approach is amazing. So thank you so much for sharing that. And please pop any questions you have for Laura in the chat as well. So the next speaker that we have for community health updates is Kaya De Silva from the Arnhem Land Progress Aboriginal Corporation. Kaya De Silva is the nutrition manager at the Arnhem Land Progress Aboriginal Corporation, ALPA, and has previously worked as a public health nutritionist dietitian for the Northern Territory Government. Welcome, Kaya.
Thanks, Deepa. Can you see my presentation?
Yes, yeah.
Okay, great. It's a bit slow on my end, so hopefully this works. Otherwise, you might need to share it. So first, I'd like to start by acknowledging the traditional owners on the land that I'm presenting on today, the Larrakia people, and pay my respects to elders past, present, and emerging, as well as Aboriginal and Torres Strait Islander peoples that are here today. I feel pretty privileged to be able to share what we're doing in the remote store space. You know, remote retailers have been trailblazers in supporting healthy food and drink purchases, and I think the rest of Australia really need to catch up with what's being done in the remote space and learn from what we're doing. Has it moved on to the next slide? Because it's not working on my side.
No, it hasn't. Oh, it's now. Oh, yeah, it has.
Okay, thanks. So I'm going to start by, I'm going to share the nutrition, Alpa Nutrition story today, but first just helping you understand remote retail and Alpa in general. So who are Alpa? We are the largest Aboriginal corporation in Australia, and we have 80% Aboriginal and Torres Strait Islander employment. That's a big focus of ours, is to really support local employment. You can see the map is where we're located across Northern Territory and far north Queensland. So we're the geographical space of South Africa. So it's a lot of places to get around, and we operate in, you know, the toughest retail conditions in Australia in some of the remotest locations. The majority of our stores only receive 1 delivery a week because that's all we can access and it's all that the stores can afford. So that can make trading in the bush quite challenging and supporting healthy retailing quite challenging, but we really try and work past those barriers to help our customers. Our population that we service across all of the stores is close to 20,000 people, so a significant population. And, you know, understanding remote communities, some of our communities, it's 300 people ranging to 3,000 people. In 50% of the stores that we operate in, the communities that we operate in, we're the only store. So we acknowledge and really that we're the primary food source and have a big responsibility to play to really support customers to have access to healthy foods and drinks. In the other 50%, we do have competition. And I think a lot of people think, you know, it's a lot easier to do healthy retailing when you're the only store, and they don't realise that there are other stores in these communities that aren't doing the same thing that people like Alpa are doing, and can make it quite challenging to implement healthy food and drink strategies because they're not doing the same type of work, and it might impact the store viability. So we might lose customers because we're trying to do something that the other store isn't doing. Our ownership structure is really unique. So all of the stores are community owned, and the surplus, so the profits that are generated from those stores, go back into those communities. So we're non-for-profit. The profits are there to support the repairs and maintenance of the store, because we don't receive many government support funding to support those repairs. But we also, the surpluses go to support benevolent activities. So these are things that support, you know, cultural ceremonies, as well as health and nutrition programs and education programs. So the work that I do and what our team does is completely funded by the surpluses generated from the Alpa stores and not from government support. Store viability is really important to consider, and I heard someone talk about, you know, the fact that stores do need to make profit. And it's really different in the remote space, because we need to make sure that stores are making profit to maintain viability, so that the store doors are open. Because if we're not making money, then those stores are going to close. And like I said, you know, we are in 50% of the communities that we operate in, we're the only store. So if you have that store closed because they're not profitable, then there's going to be major food security issues for that community. And people are, you know, hundreds of kilometres away from the next store. So profitability is something that, from a nutrition point of view, we have to consider every day in what we're doing, and if it's going to impact viability of the store. There's some photos of our store. So a lot of people don't really know what a remote store will look like, and they're quite surprised when they realise it's just like every other store, except that we're not just a grocery store. We're also, you know, the hardware store and the post office and the takeaway, and we're everything. We're a one-stop shop. The people in the red shirts there, they're our board of directors, our all Yolngu board of directors. So representatives from the communities that own Alpa, and they're traditional owners and community elected members. So they're my bosses, and they own the health and nutrition program. So everything that we do is governed by them, and they're, you know, just so committed to health and nutrition. And they keep me accountable. So every quarter I have to report back to our board of directors on how we're going against our nutrition KPIs. And our KPIs are really focused around increasing fruit and veg volume, increasing healthy takeaway participation, reducing sugar. And the photo down the bottom is our beautiful team in Ramingining. So the health and nutrition strategy, the Alpa Health and Nutrition Strategy, has been in place since the 1980s. So Alpa started in the 1970s. So this year is our 50th anniversary, and close to the start of our journey in retail, nutrition was a focus of the board, which is just amazing to think that there was a strategy in place in the 1980s when we still have, you know, big supermarkets that are still not talking a lot about health and nutrition. So our strategy, we have 4 key objectives. So the first one being increasing the affordability of healthy food and drink options. We are very aware that remote food prices are the most expensive prices in Australia, and you know, we're servicing some of the most disadvantaged people in Australia, and there's a great need to improve affordability, and we get very limited support from the government to do that. So we have to put our own strategies in place to improve the affordability of healthy food and drink options. So some of those strategies include reducing the markup of healthy foods and drinks, so that all of our healthy foods and drinks have a lower markup to our unhealthy foods and drinks to try and drive people towards a healthier choice. We also have an Alpa freight subsidy, which I'll talk about on the next slide, and work really hard to try and advocate for government support to help bring prices down. You know, the latest pricing inquiry, you know, there was a lot of allegations around price gouging in the remote store space, and then they found that it's just the, what happens with doing business in the bush. We don't have the same buying power as the major supermarkets. Across our 26 stores, we're still equivalent to 1 or 2 Coles and Woolworths. So we just can't negotiate the best prices, and then it's really expensive to get stock out. So we need government support to really reduce that price gap. The next big objective is increasing the availability of healthy food and drink options. And so our store nutrition policy really supports that availability. So we've got minimum stocking requirements across all food groups and also non-food products that support people to make healthy foods and drinks and store healthy foods and drinks, as well as other health hardware items. So all of our stores have to complete monthly nutrition policy audits to see that our policies are in place, and then work with us to resolve anything that isn't in place. And my nutrition team, we go out on a regular basis to complete audits and work through challenges with our stores and our suppliers and our transport companies to increase the availability of healthy foods and drinks. Our third strategy is about supporting customers to make healthy food and drink choices. So something that I want us to say at the start is that you can still buy unhealthy foods and drinks in our stores, and the board of directors are strong that we have to maintain choice. So unhealthy foods and drinks are available, but they're not promoted. We want to maintain choice to respect people and people's choices, but we don't want to force people to buy the unhealthy foods and drinks. So we've got strong policies in place around where things can be placed. So removing things from high traffic areas, counters, front ends of aisles, near our ATMs is really high traffic, and replacing them with either healthy foods or non-food products. But a part of supporting customers to make healthy food and drink choices is also how we promote products. So there's no promotion on any unhealthy food and drink choices, and buy one, get one free. And that's the work that we do with our suppliers to make sure that any promotions that they come to us with, that it's in line with our policy. And we do get good support from them in doing so. The final objective is around increasing awareness and understanding of health and nutrition. And, we're very strong in that we've got to set up stores that they're going to support people to make healthy food and drink choices first. And education is the next big thing. But we can't just do education. We need to make sure that the bones of that store are perfect. So in terms of education, we have programs in place to provide, to deliver education to community, but we're a team of 3 across 26 communities, so you can understand our capacity to deliver education is low, and that's where we work to build relationships with existing health services and help them to deliver education that's in line with the store sales data that we're seeing, so that nutritionists are targeting the things that need to be targeted.
I'm so sorry, but we've run out of time. I know you're about to present so much more, and maybe you can share some thoughts in the chat or share your slides around so that people can get some more information. I'm so sorry to cut you off. It was so interesting to hear about your work and the unique opportunities and challenges that you're facing. So I'm sorry for cutting you off one slide beforehand, but please, share your slides and people can ask you questions as well.
No worries. Sorry for going over time. I'm very passionate about what we do, and I really do, encourage questions because, we are doing a lot that other people, could learn from, and we definitely need more government support to do more. Feel free to email me. I'll share my contact details and pop onto the APA website to find out more.
Thank you so much, Kaya. So our next presentation, the last community health update we have is from Julie Brimblecombe from Monash University, who runs the Healthy Stores 2020 project. So Julie's research focuses on population dietary interventions, determinants of healthy eating and building capacity to support community-driven decision-making for nutrition improvement. She's currently leading the Shop at RIC trial, which is assessing the effect of a price discount on fruit and vegetables, diet drinks and water on store food purchases in 20 remote communities.
Okay. Whoops. Thanks, Deepa, for that introduction. And just following from Kaya's presentation, I was actually in an Alpa store just a couple of weeks ago, and it was just so impressive. And I must say, I actually found it very difficult to find the confectionery. So I think it's just amazing how ALPA has adopted these policies across their stores. So I'd like to talk about the Healthy Stores 2020 study, as well as a study that we have currently running called the Benchmarking for Healthy Stores. And so I'm presenting this very brief story on behalf of both of these research collaborations. I thought it was important to bring to everybody's attention, and I'm sure that you already are very aware of this information, but according to the Eat Healthy Diet for Sustainable Food Systems, at a global level, we actually need to double our intake of plant foods and halve our intake of red meat and sugar. And so our diet, our diets today from that of our ancestors have changed absolutely drastically with food, with industrialisation of the food system. But for Aboriginal and Torres Strait Islander peoples, there's been the impact on Indigenous food systems with settler colonisation, as well as with food industrialisation. And this has just had such devastating impacts on health for Aboriginal and Torres Strait Islander peoples. And this health impact is disproportionately experienced by people in remote communities. So thinking about the transformational shift that needs to occur in diets globally, we had the opportunity with funding from the National Aboriginal and Torres Strait Islander Health Equity Council in about 2012-2013 to model the optimal diet using purchasing data from remote communities at least cost. So the optimal diet that would achieve nutrient requirements at least cost. And what we found based on current purchasing patterns was that plant foods, fruit, vegetables, dairy, the healthier kind of food products, fish and seafood, eggs, whole grain cereals would have to increase by 4 times. Similarly to what Eat Healthy Diet for Sustainable Food Systems has announced, huge reductions in sugar sweetened beverages and refined cereals required. So 90% reduction, and the halving of purchases of processed meat and sugar and confectionery. So the high intake of sugar is definitely a concern, like Kaya talked about. The health of the community is a concern for the ALPA Aboriginal directors. The high intake of sugar seen across not just remote communities, but all of Australia is a particular concern for community leaders. And so in partnership with ALPA, we determined at this particular time that free sugars as a percent of energy was 2.6 times that of the WHO recommendation of free sugars being less than 10% of energy. So we then partnered, so having this information, the concern about sugar and health from the ALPA board, and having this information about the high intake of sugar, we partnered with ALPA to co-design a strategy that could be feasibly implemented in their stores to reduce sales of key product groups that were contributing to sugar. So if you look at scanner data that the Australian Bureau of Statistics has from supermarkets for Australia, you'll see a similar distribution of the key product types that are contributing to sugar intake. It's what we see in remote communities. So table sugar and sugar sweetened beverages being major contributors to the sugar purchase through remote stores, as well as confectionery and sweet biscuits. So the Healthy Stores 2020 strategy was co-designed with ALPA to be able to have what we hoped would be the biggest impact on the sales of these key contributors to sugar. So we call it a 7-point strategy. There are 3 strategies at the bottom of this infographic here combined as one strategy. But the 7-point strategy is no promotions on unhealthy foods and drinks, no misleading promotions, no unhealthy food and drinks in highly visible areas, so no confectionery at counters, end of aisles, etc. Halving of the shelf space or the facings of table sugar confectionery sweet biscuits, and then reducing the proportion of sugary drinks to overall drinks through modifying the facings, as well as removing the large size unit soft drinks out of the fridge, and then promoting how much sugar is in different types of products and promoting water. So this strategy was put in place in 10 strategy stores. We had controlled stores as well. And over a 12-week period, it showed that there was 1.8 tonnes less of free sugar sold through those 10 remote community stores. And so this was a 2.8% reduction in free sugar to energy. And this using existing evidence would translate to having important clinical outcomes, particularly mortality from heart disease. So in thinking about how might this strategy be adopted across stores, we had the opportunity of interviewing store managers that were responsible for the implementation of the strategy. And there were a number of key factors that interacted together that enabled the successful implementation of the strategy within stores. And one of those factors, I'm not going to go through all of them. We've got a paper under review at the moment. Hopefully it'll soon be published. So this information is available. But that strong sense of social purpose, which Kaya talked about, within ALPA, their leadership within all levels of the organisation, and that communication of the importance of this strategy through those different levels through to the store manager, that was then able to draw on their retail expertise to train up their staff and make sure that there was good implementation of the strategy. So we use the consolidated framework for implementation research to really try to get an understanding of what these key factors were. So ALPA has adopted the Healthy Stores 2020 strategy into their store policy or strategy that Kaya talked about, but obviously there's a lot more within their policy than just the Healthy Stores 2020 strategy. So our question now is, how can all remote stores be adopted? Oh, sorry, not be adopted. How can all remote stores be supported to adopt the Healthy Stores 2020 strategy, as well as other best evidence policies for health enabling stores? So we believe that benchmarking is a tool that can help with this. So benchmarking is defined as when an organisation or a company or a store in this situation receives feedback on their performance against a comparator, which in this case is best policy action. So it's a data-driven process where stores are assessed against best practice policy, and then they're provided with feedback so that they can see how they're performing against this best evidence standard. And they can also see how they're performing against all other stores. So as you can see here, there's different frameworks for benchmarking, and this framework here describes 6 different steps to the benchmarking process, and sees benchmarking as a tool to help achieve continuous improvement. So what does the benchmarking model look like that we've been co-designing with different partner organisations, including ALPA? It draws from that continuous improvement framework of plan, do, collect, learn. And so the first part is doing an assessment of the store's healthiness, providing that feedback to stores and helping to make recommendations about how they might be able to strengthen their policy, and then working with that store to put in place an action plan and help with the implementation of that action plan through the public health nutritionists that support that store. So with our benchmarking model that we're in the process of co-designing, there's 5 key areas. So I've talked about best practice policy. We've, through work that's been led by Dr. Megan Ferguson, with retailers and community stakeholders, we've identified 21 best practice policies that could be implemented by remote stores to help improve the healthiness and the affordability of the remote store. We then have developed an app called the Store Scout app, which can assess how those policies are actually translated into practice. So we can use that app to make observations of store practice. And then we're asking the stores that we're working with to provide their store sales data so we can provide key information back to stores on their turnover of fruit and vegetables, their turnover of sugar from foods and drinks sold, and looking at the proportion of foods that are sold that are healthy. So a lot of stores are receiving this kind of information, like ALPA, for example, have invested a lot of resources to make sure that store directors are receiving this important information that can help drive change. But this project will support stores outside of those organisations to also be able to receive this kind of information. We also have developed a survey where stores can assess, their infrastructure, staffing, transportation, delivery of food to the store, to start to look at how those external factors to the store make it easy or make it really challenging for stores to put good policy in place. So the study that we've got happening at the moment, we're just about to start baseline data collection. We have about just over 30 stores so far participating in this study. And so these stores will be randomized to a strategy or control group, where the strategy group will receive the benchmarking approach each year for the next 3 years. So I hope that kind of gives you an overview of some of the work that we're doing with remote stores. I think this benchmarking project is really exciting to help look at, how we might be able to support all remote stores to be able to adopt health enabling policy for their stores. Just like to quickly acknowledge the many different people that are involved in this work, and also acknowledge the Medical Research Future Fund, who are funding the benchmarking study, and acknowledge the 5 partner organisations for the benchmarking study. So thank you.
Thank you so much, Julie. That was wonderful. It's so great to hear that, and such a great flow on from Kaya's presentation as well. We were meant to go into breakout rooms, but we're not really going to have time. And I think so many people have such questions that they want to ask the group as well, and the amazing speakers. So we'll just open up to Q&A. I might be a little cheeky and get the first question in, and because I kind of stopped Kaya short, I wanted to see what she had to say around that long-term plan that she had around ALPA. Kai, I'd love to see that slide again and understand more of that greater vision that you have going forward. If you're happy to share your slide again or just talk us through it. Perfect. Oh, you're on mute, Kaya.
Sorry. It was really sharing this journey we've been on, and then I can talk to where we're going. But like I said, the nutrition strategy has been around since the 1980s and continues to be developed in line with dietary guideline recommendations, as well as the research being done in the healthy retailing space. We, in the 1980s, launched our freight subsidy for fruit and veg, fresh, frozen and tinned. So customers don't pay that portion when they're paying for fruit and veg, they're not paying for the freight. And this was in lieu of government support to subsidise the freight on fruit and veg. In the early 2000s, that expanded to dairy. And then last year, we expanded it to meat and baby food. And that's, again, still in lieu of any support from government to reduce the prices that it costs to get food to the remotest locations in Australia, which is quite shameful, in my opinion. In the early 2000s, we employed a health and nutrition manager to support the board to really implement the strategy well. Before that, it was being implemented, but just from all people within ALPA, and didn't really have that targeted focus. And that's now expanded to 3 people that are all funded from the surpluses of the store. So it'd be amazing to be able to get some more capacity to really continue to do the great work that we're doing. And then in the early 2000s, we worked closely with research organisations and with researchers like Julie to test new ways of doing healthy retailing and to contribute to the evidence to support other people to join ALPA on the journey to improve stores. And then, in the early 2000s, in 2018 was when we co-designed Healthy Stores 2020 with Julie at Monash University. And that was really the first one that was developed with retailer expertise built into it, which is really important, researchers, including retailers in research. And so we continue to do that at ALPA. And there's, great commitment from ALPA to continue what we're doing in the nutrition space. And, I get amazing support from our board to really advocate for what we're doing and the support that we need to continue to improve access to affordable, healthy foods in remote spaces. So does that answer your question?
Yes, thank you so much, Kyle. It was great to see, often you see these pieces of work and you just see that flash of something great that's happened, but seeing all the foundational work and all the difficulties that you've kind of gone through, but also just persevered through, and just your strategies in working towards that, it's just incredible. So thank you so much for sharing that. And I'm glad that we got to get through your presentation, but as mentioned, all the slides will be sent out as well. I'm now going to open it up if anyone has any other questions. I can't see anything that's popped up in the...
I have a question. Can I jump in?
Tom?
Hi. Kaya, I have a question for you as well. I was wondering, did you have any trouble getting supermarkets on board to reduce advertising of unhealthy foods and stuff?
Do you mean food manufacturers?
No, I thought you were, didn't you say there were policies in place now to not promote unhealthy foods in supermarkets?
Yeah, so our supermarkets are community owned and all come under the ALPA Health and Nutrition Policy. So the directors of our stores, which are community leaders, they're the ones that sign off on our policies, and they're the ones that sign off on promote unhealthy foods and drinks and have them in high traffic areas. And so because our board govern everything we do, it trickles down the organisation, and that's the real strength of the ALPA Health and Nutrition program, because it's not me as a nutritionist battling my way to the top. It's owned by our board, and it goes all the way down from our CEO down. So no one can really, people might disagree with what we do, which is rare, because people understand when they join ALPA, ALPA do food retail very differently, and nutrition is part of that. And so but if they, I guess, disagreed, they don't have a choice because they fall under our policy, and they would be, you know, having conversations with the CEO or our general manager of retail about it. So we've got really great support and continue to have good support. And where there is challenges, it's always dealt with in the best way to bring the whole team on the journey. And I work really hard to bring that whole team on the journey and understand why it's so important to make those changes to support, you know, better health outcomes.
Yeah, right. That's amazing. Great work.
Thanks, Tom.
Thank you, Tom. Anyone else? Any questions for any of the presenters?
I have a question, but I'm not sure if it's more of a Julie question or a Kaya question. So whoever would like to answer, where do the sort of sugar replacement drinks fit into all this? Sort of like the Pepsi Maxes and that sort of thing. Are they in the, yeah, that's good, you know, sort of better than the alternative, or bad?
Like from an ALPA perspective, when we look at soft drink consumption, you know, we do have higher soft drink consumption, and we have big policies in place to drive people towards water. You know, water doesn't taste the best out in community, and so you know, people do rely on water, and so our waters are $1, which is the cheapest branded, I won't say the brand, but the cheapest brand of bottled water, I think, in the country. But yeah, we see that diet soft drinks artificial sweeteners are, I guess, the lesser of two evils. We do have strategies to try and support people to move from soft drinks to diet soft drinks as well, because the consumption of soft drinks are so high, and the reality of switching straight to water can be quite a challenge, you know, for people. So, you know, we do have pricing strategies in place to drive people towards diet soft drinks, and we treat diet soft drinks as an amber product within our policy. So there are promotions on diet soft drinks to try and get people off the full sugar soft drinks.
Okay, thank you for that.
Thank you. Thanks, Steve. Anyone else? Any questions? I'm sure, unfortunately, Laura's had to leave. So if you have any questions for her, we can pass it on separately, or you can reach out to her directly from the details she provided.
Sorry, I have another one. This one's for Julie.
Go ahead.
Julie, I was really interested in one of your first slides. I forget what it was called. It was like modeling to like meet dietary requirements at the least cost or something. I'm curious to know what that looked like in real life. Like, did you come up with like a shopping list that would meet those requirements at a low cost?
Yeah, so we used optimization modeling, which is like an add-on in Excel. We had the purchasing data, so we had data across a number of remote communities, which included the store as well as purchasing data from other outlets and the school within those communities. So then we had, you know, all of that data, which is essentially all of the products that were sold, the quantity of those products that were sold, so their unit weight times the number of units that were sold over a 12-month period. And we had the total dollar value. So then in the modelling, we came up with different restraints for the model. So we wanted to achieve the nutrient requirements, so the NRVs, which we did achieve for all of the nutrients except for sodium and saturated fat. And we also wanted to achieve the recommendations to reduce chronic disease, so the correct distributions of the macro nutrients. We then, to make it so that it was a diet that would still be, I suppose, appealing to people, we put restraints on how much different types of food groups could increase by or decrease by. So based on that model, we then came up with a solution, which is what I presented today. So the input and outcome was, you know, to try to come up with a diet within the model constraints that would be at least cost. Does that help explain, Tom, some of the process that we went through? Yeah.
I think I just got a lot of information very quickly, and so I needed to hear it again.
Yeah. I can send you the paper as well.
Yeah, cool. That'd be great. Thanks.
Okay, thanks.
Thank you, Tom. Thank you, Julie. Any other questions out there, even from like a few people back to leave, which is completely fine. It's a very long meeting. Any questions out there? Dina's still here as well. Thank you, Dina. I might then just ask a question. I might throw a question to Dina. Dina, what do you see as some of the opportunities in that supermarket space in getting young people involved, and how do you think we should present that information? And maybe this is something that other people can think about as well. Like, it's great to see how young people's voices can be the part of engaging young people in, but also how can we use that tool to advocate to the retailers themselves and presenting the information in a way to them that they're going to connect to and go, oh, I need to do something about it. Have you had experiences in this in other sectors that you can give us some advice on?
Thanks, Deepa. I think I certainly can't speak back to working explicitly and directly with retail environments, but I can say that food retail environments did feature across the data that was collected by kids as part of kids co-designing healthy places. And so most of the conversations around healthy food was around access to healthy food, and that they recognised that there was, in some environments, there were a lot of fast food places. But what was happening was that they were comparing McDonald's to Subway. And so McDonald's was the unhealthy option and Subway was the healthier option, which says something, I think, about Subway's marketing. But I do think there is real potential to think about how we could reframe that audit process to explicitly engage with retail environments, and using some of those tools around what it might be to audit retail environments or supermarkets, and to help generate kids' understandings of, you know, marketing and the marketing tactics that are used and the position, all of those kinds of concepts. So there is real opportunity, but that working with, like, thinking about what Julie's done and other presenters have done around connecting with the retailers is a piece that we don't have at this particular stage.
Thanks, Dina. It'd be great if we can see how we can connect those two things, isn't it? You've got the kids side and the kids' voice side, and then we've got other people on the call like Julie and Kaya who've got the retail side. So I'd love to see some future collaborations. I guess you and Julie at the same university as well, so that helps. I can see that Lucy has posted a question and kind of thrown it out to anyone in the call or any of the other presenters. And I guess Dina's already spoken to this, have any attendees on the call tried novel ways of meaningfully engaging young people in co-design of healthy food environments? I don't know if Julie or Kaya, you had any experience in this space or anything that you wanted to share, otherwise we can throw it to everyone. Yes, as Lucy mentioned, feel free to drop in the chat if you don't feel like unmuting and saying it out loud.
From ALPA, we have community advisory committees. So we've got people who meet with community and have representation from every clan within those communities that can hear what we're doing in the remote store space and provide feedback. So that allows for young people to be part of that conversation, but it's whether or not young people attend or are feeling welcome to attend those community advisory committees is the other thing. It can be a challenge, but that is one mechanism to get engagement, to really get some understanding of what we're doing and what we could do better from the youth point of view.
So Victoria, thanks, Kaya.
Yeah, ours is a little bit early days, but one of our action teams is looking at farm to school and whether schools would be keen to explore linking farmers more directly with schools. And we are trying at the moment to get the student voice, so get the kids' views on that. So we have a survey out that asks school teachers and kitchen garden educators. But the next phase of that will also be including the student voice in that. So asking the kids their views and what they would welcome in terms of veggie box deliveries, gardens, etc. So we're quite keen to find that out as well.
Yeah, and just following on from that, Victoria, we with the Sandro De Mayo Foundation and City of Melbourne and Fed Square run a little food festival every year. We've worked, we've connected also with Melbourne Knowledge Week, and the activations in that festival, and some of you may have seen it, kind of scaffolded in a way that we get kids to the end of the trail and we ask them about what their ideas are for a future healthy, more sustainable food future. And we've used a whole range of different ways to encourage participation and ideas from kids once they've been through the little food festival. So that's one example. And one year we did get them to do the Minecraft challenge to create a healthy future food sustainable world. And I've put an example in the chat to see what the kids came up with. So there are a couple of things we've done.
Awesome. Well, thank you, everyone. I'm going to just wrap us up now because I can see we're 3 minutes from midday. I'll just get Nicole to share the last slide. Thank you to all our presenters who have stuck around to the very end. We really appreciate your time and your wealth of knowledge and experience, sharing your learnings here with our community of practice. Thank you to everyone's contribution and your interest in creating healthier supermarket environments for your own local community. A reminder that a copy of these slides and the recording will be emailed to you and also publicly available on the Nourish Network website. And if you know anyone else that would benefit from joining this community of practice, please get in touch via the Nourish Network website, or you can email Julian as well. Just a reminder to contribute to the Healthy Supermarkets Community of Practice Miro board. It's a great resource that we've created. We've recently posted a new case study of the original Healthy Supermarkets trial called Eat Well at IGA that was done in Bendigo. So that's a great little case study there that you can read. That's also on the Nourish Network website. There's some new research papers that have been put in the Miro link, as well as some events of interest. So if you've got anything else that you think is relevant for this group, feel free to pop it in the Miro board. Our next community of practice will be on Tuesday, the 25th of October. And Julian will also send an invitation out to everyone. If you've got a project update you'd like to present and share with the community of practice, if you've got a project barrier or hurdle you'd like workshopped, we can use that time in breakout groups as well. So feel free to reach out if you've got something you want to brainstorm with the rest of the group and use their expertise. And if you've got a community announcement about any events, feel free to let us know and we can create a 5-minute time slot for you as well. And any feedback as well. If you've got any feedback for us, feel free to email Julian. But we thank you all for coming today and we look forward to seeing you in October. Have a great rest of the week and stay well, everyone.
Thank you.
Bye,
Thanks, everyone. Take care.
Thank you.